The BC Support Unit, Advancing Patient-Oriented Research, is a member of the BC Academic Health Science Network and a part of Canada's strategy for patient-oriented research. Patient-oriented research is done in partnership with patients, answers research questions that matter to patients, aims to improve healthcare. Learn more at bcsupportunit.ca.
Participation matters, and if you'll make that change, it's up to you.
SPORE is encouraging researchers to partner with patients in their research. And I do believe that patients can be part of every aspect of research.
Don't do it because there's going to be benefit for you, but maybe do it because there's going to be benefit for the next generation.
In the greater scale of things, I'd like to feel that yes, what I'm doing is making a difference, but bottom line is it makes a difference to me.
It offered us an opportunity for our traditional knowledge keepers to be able to bring what they know forward into the present healthcare system.
I think the best research comes from researchers and patients, where they work together in partnership.
I think that what SPORE has done for patients in Canada is it has helped us to realize that, and to help clinicians, physicians, researchers to realize that you need to involve the end user.
When I heard about the strategies part of patient-oriented research, I like the idea of it being strategic. I hadn't really been involved in patient-oriented research, so that was new to me.
It's a privilege as a researcher to engage in research with residents, and you can see firsthand the real benefits and joy that it can have to their lives.
I'm sometimes the expert in my own body. I know how drugs interact with things. I know when I need sleep. I know when a doctor may prescribe something and it doesn't work for me.
Institutions don't help poor people anymore. We have to change it up. We've been doing something for so long and it's not going anywhere. You have to change it.
This instruction or help that we are getting is too generic, and it doesn't apply to certain sections of the population.
We know that to change the health of a population, it's going to happen in community. It's not going to happen in the doctor's office. Is important. We do acute care. We take care of the problems. But if we really want to change our health statistics and the health of our population, we need to get to the community.
So we're looking at how do we include ourselves? What is that vision moving forward?
I think everyone's different. And I think that if you partner with your knowledge users, we can create something, or we can adapt things that are already existing to meet their needs.
It's being done in a mindful way that incorporates patients' voices.
Community members want so much to be involved in their research, and that to kind of inform the goals of research with the community members is so important, because it makes the results tangible and very applicable to them in the end, which is kind of the goal of research.
Because when you partner and you collaborate, you're able to explore possibilities that you never thought you would be able to.
And so I think we've had a really enthusiastic response from community members.
Patients really need to be involved as partners.
I have a voice. I have a voice on behalf of patients, but more importantly, I think I have a voice of my own.
The best part is being able to see the changes starting to happen.
One of the things that was so impressive and so exciting to me was just how enthusiastic everybody was to be involved and to get the results and be a part of the research process, rather than just being participants and then maybe seeing an outcome, to actually help develop the research, be a part of that, and then use the outcomes in their own communities.
Sometimes I need help, and when I do need help, I'm not afraid to ask questions. And I want other patients to feel that they can ask questions as well.
Every perspective is unique, and that we need to actually work with community in order to make something that's going to be relevant and useful.
The reason I think that it's so important to have patients involved in every aspect is because they have a wealth of experience, and this experience should not be ignored.
We have to do better for each other And it's what we do today that creates a bigger path for tomorrow. And that's why I do what I do.
To learn more, contact us at bcsupportunit.ca.